Hello, everyone. Welcome. We are here at the Climate Healers 2020, Vegan World 2026 Virtual Convergence, and we are very fortunate to have people joining us today. We have Maya Acosta, who's going to introduce our speaker today. Thank you.
All right, wonderful. Well, we have Dr. Nancy Eriksen. She's board certified in obstetrics and gynecology, maternal-fetal medicine and lifestyle medicine. She is currently an associate professor of maternal-fetal medicine at Baylor College of Medicine in Houston, Texas. And she is co-chair of the pregnancy subcommittee within the American College of Lifestyle Medicine. And today she will be speaking to us about how whole plant-based nutrition can support you through menopause. Welcome, Nancy.
Thanks, Maya. I'm going to share my screen. Get going here. Okay, great. Well, it's a pleasure to be invited to speak today, and I'm so glad you could join. I kind of wanted to give you some perspective as why I'm doing a talk on menopause when my full-time job is dealing only with pregnant women. And as Maya said, I'm very involved in promoting whole food plant-based nutrition and lifestyle medicine in general, preconceptually and during pregnancy. But for my own journey, I just became whole food plant-based just right after I went through menopause almost 10 years ago. So this is another area that's near and dear to my heart. And I wanted to share with you some tools that can help with this. So today, our objectives are really to recognize the impact of nutrition and lifestyle factors on hormonal health, osteoporosis, and breast cancer risk, and to discuss lifestyle strategies, in particular nutrition, to optimize your health during menopause. And finally, to discuss how a whole food plant-based diet can enhance your hormonal health, prevent osteoporosis, and breast cancer. But before I go down that road, I do want to bring this all into perspective again, and that is the leading killer of women is heart disease. And interestingly enough, a whole food plant-based diet can prevent and reverse heart disease. And what's good for your heart is also good during menopause. So it really presents a window of opportunity, and that's what happened to me. I became aware of all of this information just as I was going through menopause. And I had tremendous problem with hot flushes. And when I was a resident over 30 years ago, I learned about, the Women's Health Initiative. Originally, I was thinking, oh, I'll just go on Prempro when I, go through menopause. But this study came out in the early 90s and not early 90s, but just after in the early 2000s. And it was a very large study that looked at hormonal replacement therapy, or HRT, with the equine estrogen and hydroxyprogesterone acetate, and looked at how that would impact the heart. So the idea of doing this study was if we keep women on hormones throughout menopause, then we should decrease heart disease. In fact, the opposite was true. There was almost a 30% increase in heart disease and a 26% increased risk of breast cancer. And the results were so alarming, they actually stopped the study prematurely at 5 years. So this is what happened to me. I got real hot, but it came in flashes. And then I went looking for some sort of dietary pattern that would help me with it. So the basic 3 components of menopausal symptoms include the vasomotor, the hot flushes and night sweats, which ironically also are the main reason for insomnia. Some of the central changes that can occur also involve brain fog, loss of libido, memory loss, and then finally urogenital symptoms. So vasomotor symptoms are very common, particularly in the United States, as compared to Asian women, which have a very low incidence of it. And interestingly enough, they last for a median of 10 years. So the older or further along you get in menopause, the less risk you have of hot flushes. That means the time that you're in that perimenopausal time is an ideal one to look at nutrition for optimizing your health. The vasomotor symptoms are, as I mentioned before, are the most common reason for sleep irregularities and is actually one of the highest motivating factors for me making this change. So let's look at one component of a whole food plant-based diet, and that's soy. This very large prospective study was done in Japan over 6 years, and they looked at dietary soy. And they, as you can tell from the second bullet, they eat a lot of soy. So the amount that they're eating, 116 grams a day, is the equivalent of roughly 1.5 cups of soybeans a day. They noticed that the more soy they ate, the less risk they had for hot flushes. And that was even after adjusting for other things, including fat, total protein, fiber, and vitamins. So that meant that the soy really did have a specific impact. And this meta-analysis went even further, looking at 10 studies, and noticed that the phytoestrogens found in soy significantly reduced hot flush frequency compared to placebo. So why is that? Well, we know that there's soy isoflavones. One of the most common ones is genistein, and they act as anti-estrogens when estrogen levels are high, as in before menopause, and then they act as estrogens when estrogen levels are low. So clinically, they act like the drug tamoxifen, which is used to kind of block the estrogen receptors, particularly in women who have had breast cancer. So there's a big distinction I want to make here, because there is a misnomer that soy is bad for women's health, and that's just simply not true. And the reason is because of how soy acts on receptors compared to estrogen. Estrogen primarily binds the alpha receptors, which are found in the endometrium, the breast, and ovarian stromal cells, the ones that are most commonly linked with cancer later on in life. Whereas plant phytoestrogens bind predominantly to beta receptors and the other types of cells in the ovary called the granulosa cells, the kidney, brain, and importantly, the bone, heart, lungs, intestine, and endothelial cells. So that means that soy has many different benefits, not just for hot flushes, but it actually improves endothelial function and increases blood flow, reduces your blood pressure. It's got an anti-inflammatory effect. And because you're eating soy, and in Japan, they eat a lot more soy than they do meat products, so they have lower blood cholesterols. It has antioxidant effects. So in essence, soy in your diet does improve your overall health. And I know this slide is busy, but if you just look at the left column, it kind of just runs you through some of the benefits of soy. Again, it affects, not only improves your vasomotor symptoms, it improves your cardiac health, it can reduce your risk for obesity, it can lower your fasting blood glucoses, it can reduce your risk for cancer, and even improve your stress responses. So that's all fine and good, but how does it stack up to actual hormonal replacement therapy? Well, it wasn't that long ago that this double-blind randomized controlled trial was done, looking at 90 milligrams of soy isoflavone, which again is a little bit of about 1.5 cups of whole food, whole soybeans, versus hormonal replacement therapy versus placebo. And it was done over 4 months. What they noticed that both soy and the hormone replacement therapy group had significant reduced hot flushes, muscle aches, and vaginal dryness. What that essentially means is the soy worked just as good as hormonal replacement therapy. And guess what? There were no bad side effects. So I mentioned previously how much soy is enough. Well, to get the levels that you see in Japan, which is about 102, anywhere from 50 to 102 grams a day, you're talking about roughly 1.5 cups of whole soybeans or soy of some kind per day. And again, the whole food is best for us because it's not just the isoflavone in it, it's also the antioxidants and phytonutrients that are contained within the soy. And soy is also an excellent source of protein. So how does, looking at soy is nice, but what about dietary patterns? There are not many studies looking at this, but this was one that was really well designed, looking at the vegan dietary pattern versus omnivores and how it impacted menopausal symptoms. And they noticed that the vegans had a significant reduction in the vasomotor symptoms and physical symptoms, meaning fatigue and sleep irregularity, with the greatest improvement in the perimenopausal group. Remember a few minutes ago, I mentioned that the further along you are in menopause, the less symptoms you get. So the group that's going to be impacted the most by this are ones just before and a few years after menopause. And what was also interesting is that when they did an adjusted analysis, that they found that the total vegetable, berries, and leafy green intake accounted for a significant portion of the variance in symptoms severity that differentiate vegans from omnivores. Translation, the healthier you eat as vegan diet, the better you get for symptom relief. So there was an association also between high meat intake and menopausal symptoms. Again, one of the reasons why we see a higher incidence of this in the West. So I went from that first slide to this. I went literally within about 10 days to 2 weeks, my hot flushes completely disappeared. So no matter where you are in life, this is something that can, really impact your health. And if you're just going through menopause, it really is a big help. Now, moving on to osteoporosis, I think you can see that from the slide that you don't want to get it because it makes you very vulnerable to fractures. It affects women predominantly, in part because they tend to live older than men. In fact, they represent about 80% of all the hip fractures, and they have 2 to 5 times the incidence of fractures as compared to men. And one of the reasons why this is such a big problem is you lose your mobility. And about half of women, or men for that matter, who get a fracture and they're old later in life often die from it, usually from strokes due to sedentary behaviors. This is the most common type of vertebral fracture. It's a vertebral fracture. You can see it clearly on this x-ray. But what a lot of people don't realize is that you could be walking around with a vertebral fracture and not even know it. In fact, it's typically not very well diagnosed on radiograph. So you can have lots of these and not know it. What are some of the risk factors? Well, the biggest one is obviously low estrogen, which happens through menopause. Lifestyle factors is another big one, which we'll talk about in more detail. But I also want to bring to your attention that even if haven't gone through menopause, there could be other diseases or medications that you're on that could increase your risk. So things like steroid, or if you've gone through chemotherapy or been on heparin for a long time, certain genetic diseases increase your risk, as do autoimmune diseases and things like diabetes and Cushing's disease. All of these, even at a younger age, can increase your risk for osteoporosis. This graph or table rather, kind of shows you the incidence rates of hip fractures across the world. Notice that Norway and Stockholm have a very high incidence. Why? Because they have one of the highest consumptions of dairy in the world. California is also very high. And notice at the bottom of the table that Asian women, Black women, and Hispanics typically have a much lower rate of osteoporosis and fractures than do Caucasian women. And again, the reason for this big difference is the way we eat. Notice that in the Asian population, they have a much higher phytoestrogen intake compared to the West. And the West, their protein intake primarily comes from animal and dairy products. So let's look at a few things that are bad to the bone. We all know that low calcium intake can be an issue. Typically in the United States, we don't have an issue with calcium intake because of the consumption of dairy. Low vitamin D, high salt intake, and an inflammatory diet in general. And let me explain what an inflammatory diet means. That's anything that's high in processed food, salt, animal products like meat and dairy. High caffeine intake, sedentary lifestyle, of course, smoking and alcohol use. So I'll look at these kind of one at a time. We'll go through them in more detail. So we know that calcium intake isn't really significantly associated with hip fracture rate, either in men or women. It is an important nutrient, but it's not the most important. In fact, you need magnesium to make your calcium work right. When magnesium primarily, comes from greens and beans. So you need those things together to make it really work right. There's really not a good agreement in the United States or the world for that matter, how much calcium we should take. And the best source is really food. Supplements, you don't absorb as well as food. So I always prefer, getting that mainly through diet, which you can easily get 600 to 700 milligrams a day on a plant-based diet. So again, Calcium supplementation is needed in some cases. There are some people with diseases or other problems dealing with absorption, malabsorption, that do need higher intakes, but there's really no consensus. In the United States, we recommend 1,200 milligrams a day if you're over 50, whereas in the UK, they recommend a much lower risk or lower dose. Here's a picture of the best plant-based sources of calcium. You notice the cruciferous vegetables at the top, like broccoli and cauliflower. Your beans also are a good source, as well as almonds and Brazil nuts, sunflower seeds, citrus like oranges, and molasses even. Moving on to vitamin D. Again, vitamin D is necessary for calcium to be absorbed properly. So if you're, the best way to get it is obviously exposure to the sun, but we don't always live in areas of the world where we get adequate sun exposure. And in some cases, just our lifestyle, meaning we're indoors all the time, so we don't get adequate vitamin D. There are some great plant-based sources of vitamin D, including fortified plant-based milks and juices, tofu, soy yogurt, some mushrooms. But again, to really kind of know where you're at, it's ideal to get a actual vitamin D level, and then supplement if you need it. But if you're in an area of the country, especially in the South, where you can get adequate vitamin D, that would be ideal. So I did mention that high salt intake is an inflammatory to our bodies, and is found primarily in processed foods, processed meats, fast food, canned foods, and baked goods. So it's best to avoid that if possible. Did want to just kind of mention the ketogenic diet and bone health, because the ketogenic diet has been touted as, really great for diabetes. And of course, we initially started using that for children who had intractable epilepsy. And they noticed that it seemed to improve their epilepsy, but long-term, there were a lot of problems with it. This study talks about, it's actually a small study, but pretty profound in the sense that when these children were doing this for a period of almost 10 years, they noticed that there's a high predilection for kidney stones, fractures, obviously higher cholesterol levels. It even slowed the growth in a large number of these children. And a lot of them couldn't continue the diet. So while some recommend the ketogenic diet for short-term benefits like weight loss or improving blood sugars, the bottom line is, as far as bone health is concerned, the ketogenic diet is not good at all. It's not good for your heart. So best to be avoided. Well, what about dietary patterns and risk of fractures? I mentioned the inflammatory diets. Well, we know that in the West, we eat a lot more of the processed foods, the meat and dairy. And when we do, we have a lower bone mineral density, or BMD, and higher rate of hip fractures. And that's true also when you eat less than 5 servings of fruits and vegetables per day. That increases your risk for hip fracture in a Swedish cohort. When you look at this large meta-analysis of studies that look at increased vegetable intake, they notice a reduced risk for osteoporosis by 27%. And the Mediterranean diet was associated with decreased risk of hip fracture. So again, the more fruits and vegetables, more plants you eat, the lower your risk. Here's a great study that was done looking at the vegan diet and osteoporosis of a group of vegan Buddhist nuns, ranging in age anywhere from 50 to 85. And I want you to notice that they consumed about half the calcium that the omnivores did, yet there was no correlation between the calcium intake and their bone mineral density, nor was there an increase in their fracture rate. So that's pretty important to keep in mind. I know some have said, well, if you're on a vegan diet, you're increasing your risk for fractures or lower bone mineral density, and that's just not the case. Let's look at vegan diet and fractures. This is a longitudinal study of over 100 vegan women, comparing it to omnivores. We noticed, and it's interesting that the vitamin D level was lower in the vegan group compared to omnivores, yet the rate of bone loss in the vegans was about half that of the omnivores, and the 2-year fracture rate was similar. Of course, I mentioned earlier, corticosteroid use and high intake of animal protein was negatively associated with bone loss. Okay, so how much protein is enough? I mean, I've been told by physicians I need to eat more protein. You know, I deal with the same problem most of you do, which is it's hard to talk to a physician who's not well versed in plant-based diets because they just don't get it. But I wanted to show that there is proof that a low protein diet that you get in a whole food plant-based diet that usually ranges anywhere from 8 to 12% protein per day is sufficient to maintain your bone mineral density. It seems like the sweet spot though is somewhere in the 12% range. And that's in studies that even controlled for other factors that affect bone loss, like alcohol, smoking, vitamin D, physical activity, etc. So again, that's not too hard to do. Beans is one of your highest sources of protein, and your soybeans is at top of the list. So those two work well together. Again, soy and mineral density. In this study that looked at a randomized control trial, kind of compared soy versus hormonal replacement therapy. And so they found that both soy and HRT significantly increased bone mineral density in the femoral neck and lumbar spine. So there was no adverse effect on soy on either uterus or breast. And you wouldn't expect it because remember, they only go to the tissues that have the beta receptors, and the uterus and breast have alpha receptors. They're estrogen sensitive only. They're not sensitive to soy. And when you compare soy again with the risk of fracture, this large prospective cohort study of over 62,000 men and women, they looked at for 5 years, the women and men that consume the most vegetables, fruit, and soy had a 34% reduction in the risk of hip fracture. So in summary, the things you want to do to improve bone health is to keep your protein in about the 12% range. You want to consume calcium containing foods, greens and beans, which also contain a lot of magnesium. Soy, you keep your vitamin D level in the normal range. In fact, most physicians like it in the higher range, somewhere in the 50 to 60 range. Weight-bearing exercise is helpful, as is smoking cessation and limiting alcohol. So moving on to breast cancer. Again, when you look at geography and areas that have the greatest amount of breast cancer, if you look at the blue lines that are all the way out, it's always the more developed regions, the United States, European Union, et cetera. We have the highest rate of breast cancer. When you look at places like China and India and the Pacific Rim and Africa, they have much lower rates. And again, we know that breast cancer risk does increase with age. It's, you know, the majority of women who get it over the age of 50 with a lifetime risk of about 12% or 1 in 8, which is pretty high. And again, there is an ethnic variation or disparity in this where non-Hispanic whites have the highest rate. And then followed by non-Hispanic blacks, and Hispanics and Asians have the lowest rate. We've all heard the BRCA gene. We know that it does occur for some women, but I do want to make sure you understand that it only accounts for about 10% of all breast cancer, and with the majority of breast cancer occurring under the age of 50. And the good news is the BRCA gene can be influenced by diet. So what are the overall risk factors? The biggest ones on this list are being overweight or obese, having a BMI greater than 25, alcohol consumption, and a low fiber diet. And just to remind that, you know, plants contain fiber, meat, dairy, and eggs do not. And also lack of exercise. All of these other things are risk factors too, but the first 3 are the biggest. Again, never breastfeeding, vitamin and mineral deficiencies, which you only get that when you don't eat a well-balanced diet. If you eat a whole food plant-based diet, that just doesn't typically happen. High fat dairy also has been associated with an increased risk of breast cancer, as red meat and low phytoestrogen consumption, as in soy products. So let's go through animal protein and look at how this works. So what we do know is that the World Health Organization classified all processed meat as a class 1 carcinogen, which basically means it definitely causes cancer. So things like bacon, sausage, ham, hot dogs, etc., they all cause cancer. Red meat is a class 2, which means it probably causes cancer. And we also need to be aware that, there are people who think, oh, well, I'll just get meat without nitrates. Well, there are a lot of things added to meats, especially processed meats like nitrosamines, and it doesn't necessarily mean that it's safe. So the World Cancer Research Fund basically says avoid all processed meat, and the American Cancer Society, in part because they are funded by some of the food industry, only says to limit consumption of processed meat. And let's look at some studies that look at animal protein consumption in breast cancer. So one of the earliest ones was a nurse health study that showed that if you ate more than 1.5 servings of red meat per day, you had a 97% increased risk for breast cancer. And the ARP study showed a 25% higher risk of breast cancer in people who ate red meat. In contrast, the Adventist Health Study 2, which has been going on for years, looking at a group of individuals in the Loma Linda, California area who are primarily vegetarians or vegans, and they can compare different dietary patterns. And the vegans were the only subgroup to show statistically significant drop, nearly 50% drop in breast and gynecologic cancers compared to meat eaters. When we look at dairy, we know that there's a lot of trans fat and saturated fat occur in dairy. So some people might say, well, there's no more trans fat in the US because we banned it. We banned it in processed food. The only place you find it now is in animal products. And full fat dairy poses the greatest increased risk for breast cancer, like whole milk, butter, and cheese. And women who consume the greatest amount of cheese had a 53% increased risk for breast cancer. So what can we do to prevent it? The best recommendation right now is a whole food plant-based diet to limit our alcohol and maintain a healthy weight. Exercise is also an important characteristic, but if you just achieve the top 3, you'll reduce your risk by 62%. Right now, the same diet that's used to prevent breast cancer is also used to help breast cancer survivors and can lower your risk for recurrence. All 3 of those can lower your risk for recurrence by 50%. What about screening and prevention? Some people say, well, I'll just get the screening, I'll get the mammograms done. Well, I have to remember that all of us have cancer cells running around in our body, and they're just too small to be seen on mammography. And breast cancer screening is helpful in the sense it's early detection, but it's not really a prevention strategy. So the best time to really start eating healthier is now. So you want to focus on things like high fiber, cruciferous vegetables, leafy greens, berries, and apples, soy, tomatoes, mushrooms, your garlic, onions, leeks, shallots, turmeric, and spices, and flax seeds are all considered superfoods. I don't know if you know or are aware, but only 3% of Americans consume the recommended amount of daily fiber, which is 25 grams a day. That's based on our current recommendations. And what's interesting to note is the fiber actually binds to excess estrogen and toxin and releases antioxidants. That's why the more plants you eat, the less risk there is for breast cancer. In prospective studies, 60 grams a day leads to a 60% reduction in the risk of breast cancer. The only way you're going to get that is a whole food plant-based diet. Even a vegan diet, a lot of people don't eat healthy vegan diets. The average vegan only consumes 47 grams of fiber per day. So you have to really boost it to a whole food plant-based diet. Okay, and it's best to get it, again, the way nature intended it. And soy in particular, as I mentioned, is really helpful. It's good for your bones. It reduces your risk for menopausal symptoms. And lo and behold, it helps you reduce your risk for breast cancer. And again, it works on beta cells. They're not attached to the breast. So they have an anti-estrogen effect and behaves similar to tamoxifen. And soy consumption during your lifetime can actually reduce your risk of breast cancer by 60%. And I do want to make a little bit of a clarification of that. These are studies that were done in Asia in populations that consume soy all of their life. I'm not saying if you start consuming soy later in your life, it won't have an impact, but these were people that ate a high amount of soy their entire life. And interestingly enough, in breast cancer survivors who ate the most soy had significantly longer survival, and that was irrespective whether they were hormonal receptor positive or negative. So it's good for preventing it and good for survivors. So even the American Institute for Cancer Research said it's beneficial to include soy food as part of a healthy diet for women, including those who have had breast cancer. Flaxseed is another excellent antioxidant and helpful for reducing your risk. It's the largest risk of breast cancer, that is. It's the largest source of omega-3 fatty acids, and it has 100 times more lignin precursors than any other food. Why is that important? Well, lignans are phytoestrogens, and they dampen the effects of the body's own estrogen. And so increasing the intake decreases the risk for breast cancer in postmenopausal women and reduces tumor growth in patients with breast cancer. Let's look at alcohol for a minute. You know, alcohol might technically be regarded as vegan, but we noticed that there is a dose-dependent response to the alcohol consumption and your risk for breast cancer, with 1 drink a day increasing your risk for breast cancer 10%, 2 drinks a day 20%, and so on. So we know that alcohol increases your estrogen levels, except for red wine, due to an aromatase inhibitor that it contains. It also can impair your immune function. It also inactivates folic acid, and folic acid is really essential for maintaining a lot of your body's function, including your immune function. It can create also toxic metabolites like acetaldehyde. And when you look at it from a caloric standpoint, even though it's a carbohydrate, it contains more calories per gram than even your processed foods. So in 2010, the World Health Organization classified alcohol as a definitive human breast carcinogen. And in 2014, they said that there's really no amount of alcohol that's safe. Well, I want to go down this road a little bit of alcohol and folate. Folate is contained in green vegetables, and it ensures that your DNA replicates and you don't have as many mutations or abnormalities in the actual DNA transcription. So folate deficiency, interestingly, is the most common vitamin deficiency in the world, and it's all from poor dietary intake, overconsumption of alcohol, or if you happen to have the MTHFR enzyme that converts folic acid to methylfolate. This mutation can increase your risk significantly for breast cancer, but you can lower that risk just by altering your diet and increasing the folate consumption. So again, folate comes from greens and beans. Heat destroys it, so the more raw you eat, the better it is. Some patients, particularly with the MTHFR, still have to supplement a little because they can't consume enough folate per day. And again, I just wanted to mention that it is considered a carcinogen. It's not really considered a health food. So there we go. There's your whole food, and it's loaded with folic acid or folate. So kind of as a parting comment, just for those, depending on where you are in your journey, I know I had been moving in this direction, more plants for a while. And then when I saw the scientific data and everything, I made that switch pretty quickly. But it's important to remember, you not only need to add healthy foods, you also need to take away the ones that are making you sick. And this quote by Hippocrates is very noteworthy because it says, before you heal someone, ask him if he's willing to give up the things that made him sick. And again, the things at the bottom of the picture, the fast food, the animal products, high fat, high salt diet is making us sick. And the foods at the top, our whole foods, are making us healthy. So remember, even though you can't go back and change the beginning, you can start where you are and change the ending. So thank you very much. I appreciate your interest. And if you want to know more, I'd be happy to take questions, or you can contact me at my landing page. And my email address also is nancy.eriksen, ERIKSEN, @bcm.edu. Thank you.
That was wonderful, Nancy. Is BJ here?
Wow, that was wonderful. I am so glad we got much of that on Facebook, and I'm so glad I got to hear it. You were amazing. Thank
thank-
you. We'll just see if you have a question, Paige or Vicky or anyone. I'm just so pleased that to hear that soy is okay, because we hear that again and again that you shouldn't have soy. And I'm glad that you addressed that. We only have about 3 minutes because we had a late start before the next presentation. But I think, thank you. You're also very generous for showing us how to contact you and sharing that if we have some questions. I'm going to stop the recording now.